in Sri Lanka are shared across the region. For many years, health systems treated nutrition as a supporting issue. That approach is no longer adequate. Nutrition must be part of the core of clinical care. It must guide how we prevent illness, manage disease, support recovery, and improve quality of life. Sri Lanka has made important progress in this field. The work of the Sri Lanka Medical Nutrition Association and the Sri Lanka College of Nutrition Physicians has helped raise the profile of clinical nutrition within our health system. You have created space for scientific discussion, professional training, multidisciplinary practice, and evidence-based care. That contribution deserves recognition. Your work also helps bridge an important gap. The Ministry of Health can set policy and strengthen systems. Clinicians can treat patients. Researchers can produce evidence, but people benefit most when these efforts work together. Academic sessions such as this help make that connection stronger. Clinical nutrition also links directly with public health policy. What we see in our hospitals often begins in the food environment outside them. The choices available to people, the information printed on labels, the marketing they face, and the affordability of healthy food shape their health long before they meet a doctor. That is why the government has taken steps to strengthen food regulation. Recently, under the Food Act, we amended the regulations on color coding for sugar levels in liquid food products. These regulations require clear front-of-pack color labels according to sugar content. The regulation also recognizes practical realities in packaging. Where glass bottles have limited printable space, a smaller circular logo may be used. But even this logo must carry the information clearly in Sinhala, Tamil and English along with the numeric sugar content. Public health communication must be simple, visible and accessible to all communities. This may appear to be a small regulatory detail, but such details matter. A strong health system does not depend only on hospitals, medicines and specialists. It also depends on everyday decisions that prevent disease. Labeling, food standards, school nutrition, maternal care, community education and clinical nutrition all belong to the same chain of prevention and care. As health professionals, you understand this better than anyone. A patient with diabetes does not need advice only after complications appear. A child with poor dietary habits should not receive attention only after obesity or anemia develops. An elderly patient recovering from surgery needs nutritional support as part of treatment, not as an afterthought. A cancer patient, a renal patient, a critical ill patient, and a pregnant mother all require nutrition care that is scientifically sound and clinically integrated. This is why we need stronger nutrition services across the health system. We need better screening for nutritional risk. We need stronger referral pathways. We need clinical teams that include nutrition expertise as a routine part of care. We need research that reflects Sri Lankan realities. We need guidelines that clinicians can use in busy wards and clinics. Most importantly, we need to make nutrition visible in the design of health policy. The theme of this conference also points us towards regional cooperation. Sri Lanka can learn from the experience of other countries, and we can also contribute of our own lessons. South Asia has common challenges, but each country has different experiences in public health, food regulation, clinical training, and community nutrition. When you share evidence and practice, the whole region benefits. I'm pleased that this forum brings together clinicians, academics, researchers, and policy professionals. Your discussions over these sessions can help shape better clinical practice, stronger education, and more practical public policy. The Ministry of Health values that contribution. I also want to acknowledge the leadership shown by the Sri Lanka Medical Nutrition Association and the Sri Lanka College of Nutrition Physicians. You have worked steadily to make clinical nutrition a recognized and respectable field. You have trained professionals, encouraged research, and kept nutrition on the health agenda. That work will become even more important in these years ahead. Thank you.